Today marks a milestone, as we mentioned earlier. It's been 1 year since the World Health Organization declared the coronavirus outbreak a pandemic. And it's been a year since I met the one, the only, the Dr. Payal Kohli.
Since we met, it's not just you.
Well, okay, I guess you're right, kind of. Dr. Kohli, I wanted to show you really quick a picture of us. This is right when we first met, social distancing with each other. And I just want to say thank you for keeping us sane, to our audience and to us, the host, because you really have been a lifesaver.
It's been my pleasure, Tori, and you guys have turned into not just my friends, but my family. And it's been an incredible journey. I can't wait to come in there and give you a hug, a socially undistant hug, as soon as we're all vaccinated.
Amen.
I'm here for that.
Amen. All right, now that it's been a year, we wanted to know if you would do it all over again, okay? We're going like Wayne's World. Do-do-do, do-do-do. We're backing up. What would you do differently if you could from a year ago?
So can I pick two things, Tori, or are you going to make me
choose
choose just one? Okay, so two things I would do differently. The first, I think, the communication and the messaging. The mixed messages came from the politicians, and actually they came from the scientists. And the scientists were doing it, of course, you know, because we were learning about the science and changing what we thought was the right message to give. But I think it really confused people. And a year ago today, we had 27 deaths, and now we have 531,000. So, you know, really, I think that that would be a big piece of my do-over. And then the second piece of it would be the testing. Testing. If we had tested more, if we were doing what we're doing now in terms of testing, we would have picked up all those silent spreaders and could have saved a lot of lives. What do you guys think we should have done different last year?
I agree with the messaging.
I think, and this is kind of weird, Doc, I think we just should have told people a little bit about how the scientific process works and just say, we're figuring this out. So because everything that was erroneous was jumped on, and then it kind of discredited everything that was being said. But if you're kind of figuring out, like if your stomach hurts, it might be the flu. You might have eaten something wrong. Like it takes a while to figure things out, and I don't think people gave it a chance. They just threw it away if one thing was wrong. Jeff, what do you think?
Well, I'm going to get back to doctor because nobody cares what I think. I'm not a doctor.
No one cares.
All right, so Doc, now that we have vaccines, people they're antsy to get back to normal life, right? So remind us again, once we get the vaccine, what do we need to remember about being around each other?
That's good.
Yeah, so once you get the vaccine, you guys, if you at least 2 weeks out from your second dose, if you get Moderna or Pfizer, and you're 2 weeks out if you get Johnson & Johnson, you can really start to relax your life again and do it safely. And that means seeing your other friends that are fully vaccinated, getting together in gatherings. That means going to the gym, you know, going to get your hair cut, going to the dentist, doing a lot of the things that you've been putting out. You can start to do those safely. Refrain from travel for now, just for a little bit longer until the cases in our community come down, not because it's a risk to you, but more because of the public health implications if all the vaccinated people start traveling at the same time.
All right, Doc, now we're kind of talking about this, but the end is definitely in sight. Where do we go from here?
This is a good one, Al, and I think now, today, on the 1 year mark, we really need to think about how to heal physically, how to heal emotionally, how to heal economically. And that means not flipping a switch to get our lives back to normal, but slowly easing ourselves back into normality. In fact, a survey just came out this morning that said about 50% of Americans will not be comfortable going to a gathering or being in a crowd. So I think it'll take some time, but I do think that if we can slowly get vaccinated, we can slowly think about healing and think about putting our lives back together, enjoying things again.
Yeah, mentally, I know what you mean. I see someone walking down the street, and usually I'm like, yeah, person, and now I'm like, oh, a person. Like I really gotta work on that. You know?
I'm all for keeping social distancing forever. I'm all about that.
Thank you, doctor. We'll be right back.
See, nobody wants to hear my opinion.